Good afternoon, everybody. Reed here. We're going to have a very interesting discussion today. This discussion is on borderline personality disorder. I'll teach you everything you need to know about it. This is a very interesting condition. You know, um, um, and we're going to go into the uh, the mechanisms of the disruption, the parts of the brains that are not working well, and hopefully you get a better understanding of borderline personality disorder, and most importantly, the degree of suffering that patients with this condition have. You know, I compare borderline personality disorder with the experience of people with borderline personality disorders as sort of being trapped on the um, roller coaster and you can't get off, right? And the thing about this, they describe a quality is that you don't know when the next ride is going to start, right? That's why they say, don't trigger me, right? And then have you ever noticed people who've been dealing with a lot of trauma, when they become triggered, they sort of begin to sort of recognize the process. They can sort of look at themselves. And you know what they say? You set me off. Why you set me off? What do they say? Why you got me messed up, right? You started me on that ride, right? Why did you start me on this roller coaster? And now, no matter what, how this thing goes, I'm on it and I can't get off of it. So that means you triggered my ride, right? You triggered my ride, right? In order for the word trigger to make sense as a description of the whole process, is the entire process have to have some tension in it, meaning someone had to push you up the roller coaster, right? And you recognize you there, say, please don't cut the cord, because I'm gonna have, when I go on this ride, it's going to be difficult for me. You know, you're talking about mood disturbances, all the way to severe depression, all the way up to extreme highs like um, grandiosity and things like that, euphoria, those extreme highs. And so that ride is, oh, okay, most of us live within a certain reasonable range, but some of us have the capacity to have moods outside of the range that everyone expects. And when it becomes in these high and low areas, they are very uncomfortable. So trigger means that, hey, you're gonna release your occupancy at this level, and you're gonna experience the whole range of human emotions. Hold on a second. Let me turn off my robot. Okay. All right. So I forgot what I'm talking about. Oh, so they will feel the full range of emotions, and that's not good. How do you work with rage, right? How do you pay attention with severe depression? How do you pay attention with hopelessness? And so when we look at the mood category with borderline personality disorder, I mean, they feel the full range of emotions. In addition, the great deal of stressing that they're under creates more of a hyperaginergic state where they're always on the guard, like always, like uptight and always kindled. Like that state is uncomfortable for them, right? And it results in like a distorted perception of the world. You begin to perceive things differently under those states of psychological and emotional distress. So we see in borderline personality disorder perceptual disturbances. They perceive things differently, of course, and that perception changes, right? Remember, if the person is experiencing rage, that's one interpretation of the world, right? But if they're experiencing severe depression, that's a different interpretation, right? And if they're really happy with you and euphoric, that's a different interpretation. So in many cases, you'll see many other people with borderline personality presenting very differently in different settings. Like, you look completely different. I don't even recognize you in the picture. I don't recognize you in a photo. I don't recognize you in a picture. I don't even recognize you with me, right? Um, so even though they can have the huge perceptual changes, it's, they believe whatever reality they're in. So this spectrum that they bounce up and down on mood and perception and even cognitive function, attention, concentration, and things like that, they can go from becoming very inattentive and easily distracted, unable to focus, to hyperattention, when they're stalking you, hypertensive, hyperactive, focused, driven, motivated, all those things. So even on that motivation spectrum, they bounce around constantly within these different categories, and I think that the name borderline was sort of developed because you really don't know what's going on. You don't really know if the person is being emotionally and psychologically abused or they're just psychotic. So maybe they're on the borderline of both of neurosis and psychosis. Neurotic means you're going to do what you're going to do anyway, despite what anybody tells you. When they say, hey, you shouldn't do that, and they go do it anyway. You shouldn't do that. Don't they don't do it anyway, right? You tell them, hey, you tell them, hey, you did this to me. No, I didn't. I saw you. Something was wrong with your eyes. You got cataracts, right? So these people, so another thing. So we're going to get into borderline personality disorder, and hopefully we'll get into like the mechanisms that creates it, the pathophysiology, and also the treatments, things like that. And I think after you got an understanding of this disorder, I think you would empathize with people with this disorder more. I think when you really understand how this condition is created, I think you would empathize with these people. They undergo a great deal of emotional, psychological, and sexual abuse at very early ages. And that is very damaging to any developing mind. And so at the heart of it, these are some of the unprotected victims. Can I say that? Yeah. And these are the most people who've been harmed the most, to the point where their emotional growth has been stunted, right? And so it's important to sort of understand the process, and when you engage with them, to have empathy with the struggles they're going through. And when you see them in the emotional, psychological pain, it's best to respect that pain, right? And it's better to take what they have to say as the truth, as opposed to just saying, oh, okay, yeah, it's just you again, So these are very important patients of mine, and I really enjoy taking care of them. So our discussion, this is going to be on borderline personality disorder, but also I want to recognize a lot of people I work with. I'm a psychiatrist, and I use a lot of sitters, and I use the sitters to watch the patient, to sit with the patients and accompany the patients during their hospitalization. I work with an incredibly excellent group of people, and I couldn't be more proud of the work that we are doing with our patients. So all of these years, I wanted to at least have the opportunity to thank a lot of the sitters that I've been working with over these years. And I'm going to see if I can pay for like chicken wings on Friday or something like that. So I want to see if I can give back to the sitters that I work with. And you guys been great working with you over years. I don't think that the experience with taking care of patients would be the same if it wasn't for you. And in fact, my patients always give me really good reviews on our sitters. So I at least wanted to recognize that I do appreciate the contribution you're creating to the team. And I also wanted to reiterate the importance you play on the treatment team. You are a very valuable part of the treatment team, and I want you to know that. And so I'm going to see about at least plan the chicken wings for lunch on every Fridays or something like that. And hopefully that can encourage more sitters to reflect the highest standard of patient care. What we want to do is ultimately we want to provide the best service possible. Why? Because I want people to be able to see the work that we're doing, look at our documentation, look at our patients, look at our educational program, look at the resources, see how much we're doing to try to help provide very valuable service to the South Side of Chicago. I'm not sure if there's anyone on the south side of Chicago who's more dedicated to taking care of his family than me, than his patients than me. Um, it's the south side is a very important part of this nation. South side is very important. So it's very important that the residents on the south side, all of Chicago, but mainly at the places I'm working at, it's very important that you receive the highest quality of care, right? The highest quality. This is 2025, not 1960. So you shouldn't get 1960s care. Right. So I would like to thank the sitters overall for all the help that they've been helping with over these years. It's been great. And I'm going to see if I can find ways to support you more in the future. Okay, great. So with this, first, let me go ahead and go to my discussion on borderline personality disorder. So let's see here. Okay. Okay, I don't want to go to YouTube. Let me go to, okay, Google. Explain borderline personality disorder. First, let me give you an overview of how this works first. This may be helpful for you. Okay. When we're born, remember I described people being on a roller coaster they cannot get off? That roller coaster is the ego, right? And so how does the ego create the highs and how does it create the lows? Believe it or not, it just says so. It says you depressed and therefore you feel depressed. It says you happy, therefore you feel happy. That's how it works. It's that simple, right? It's just that simple. So when a patient with borderline personality disorder experience their ego assigning anger to them after it reads the situation, it assigns anger. With growth, the individual grows and has the capacity to say, hey, I disagree with the assignment of anger. I disagree. When you do that for the first time independently, you've done something very important. You've actually escaped your ego for the first time and you're watching it. So for example, if the ego is the roller coaster and you keep sitting in the seat and somebody has the switch to turn it on all the time and you have to keep going on the ride, that's awful. At some point, somebody like me step on your, pat you on the shoulder and say, hey, you can always get off the roller coaster, meaning unbuckle the seat, get out the seat. That way, if they trigger that process, it can go on, but you can just watch it, right? See, this is the most important thing for you to know, that you can actually, you don't need to accept the mood or anything that your ego tells you. You have the option to disagree. If you disagree, then you are watching and monitoring the apparatus that controls your whole reality. That's the ultimate form of healing, is to watch everything, but not get involved. And when it goes bad, you just look at it. Oh man, shake your head, keep going. And that's all it is. But you go back and investigate and try to change things. And you get meaning you get back on the ride, right? So borderline personality disorder are people who don't know that they can get off the ride, or their willpower isn't strong enough to pull them off the seat. The game itself has an alluring quality to it where it sucks you in, where every patient with borderline personality disorder they want just one more ride, right? But that ride is dangerous, right? So when they learn to just look at the emotion, oh, I'm feeling depressed. Oh, my ego is making me feel the emotion of depression. I wonder how long it's going to make me feel this way, but I'm not depressed. When you get a chance to do that, you've healed. You have your armor, you have your shield, and there's nothing anybody can do to you. And you're bulletproof at that point. When you look at all of those around you and everything, you can say, I don't care what they say. I'm me. And then you know you're healed, right? So that's the goal. When I treat patients with borderline personality disorder, I say, hey, you don't need to get away. Hey, you need to leave. You need to move. You need to go someplace where it's not roller coasters, right? And please don't get on another one. And if you choose to get on another roller coaster, then when it starts bouncing you back and forth, don't start yelling at me. Get off the roller coaster, right? Sometimes we may have to give them medications so that the roller coaster isn't as alluring, so it doesn't pull them in as much. We can give them mood stabilizers, right? Because if they're really, really, really depressed, the fluctuations on the roller coasters can finally give them an opportunity to feel better. It's programmed steps in the roller coasters, right? Remember the cycle of violence, there's honeymoons. If every cycle of violence, there's honeymoons, right? Same thing with emotional and psychological abuse. There are cycles of it. They have to come back with a good time. Otherwise, how are they going to lure you back? How are they going to create the magnetism to lure you back to the roller coaster? And you know what? Roller coasters are the example. That's the perfect example because they line up to get on a roller coaster just to get scared. And what do? Ah! Right? Same thing. So when you're born that roller coaster is the ego. You're born with a primitive ego, meaning it's only a switching mechanism. It's good or bad, good or bad, good or bad, good or bad. Remember the old Atari and the graphics? You can see the cubes the man were made of. That's the how the primitive ego presents the world, right? Okay, but then when you grow emotionally, these two poles become more integrated, right? It becomes more a structure like this, more actually structure like this. Well, actually, like that. Well, you know what I'm talking about. And that means that someone can be bad and good at the same time. Someone could, like a parent could feed you and discipline you, right? If the parents feed you, doesn't mean that they're good. They're just feeding you. If they're disciplining, doesn't mean they're bad. They're setting boundaries, right? So either way, you can have a parent set boundaries and say, hey, my mom still loves me or my dad still loves me, as opposed to they're evil because they set boundaries towards me, right? So patients with borderline personality disorders are ultimately the ones who've had their emotional development stunted at a very early age. And the swings, the highs and the lows reflect probably the age that they were age of emotional and psychological development at that time. So the trauma stunts, halts, damages, or distinguishes that internal sense of self that forms that internal identity and the self-esteem. Now, remember, narcissists, psychopaths, and sociopaths, they always have to target your self-esteem. So they always say things, he's like this, she's like that, he's like this, she's like that, because they want you to participate in targeting someone, and eventually they want to damage that person's internalized sense of self. When they damage the person's internalized sense of self, they regress from their adult state down to where they were when they damaged, and then now they start acting out, right? So patients with borderline personality disorders are the ones who are almost stunted in their growth, so they continue to behave as at a developmentally inappropriate age, younger age. So they begin to develop begin to engage with people at the age that they were damaged. Now, this is dangerous. It's dangerous because when they regress to the early developmental stage, they no longer have the same toolbox of an adult. So they can't reason like an adult. They cannot rationalize like an adult. It's really a 6-year-old. And this person only have the tools of a 6-year-old to handle all of their problems, right? Let me show you the tools of a 6-year-old. Right? primitive defense mechanisms. So let me show you this. When you understand this, it's a very you start to understand how people work. You listen to certain things and then you run and you never go back. You never talk to them. You never talk about them. Nothing. You just leave, quietly leave, because the people who have these primitive defense mechanisms, they're very dangerous, right? Here, examples of primitive defense mechanisms: denial, people refusing to accept reality, right? Projection, people attributing one's own unacceptable thoughts, feelings, and impulses to another person. Remember when people start rumors and things like that? Rumors are based upon projections. They're really talking about all the things that they can't handle. So all the damage that happened to them at their earlier age, where they're really angry at their primary caretakers, they can't take it out on them. What they do is they suppress it, and they suppress it and they push it out of awareness. They don't want to think about it. But then it becomes too much. And now, in order for them to get relief from their suffering, they have to project their psychological trauma onto you and then say, you. That's why the narcs always do this in privacy. They have to tell each person in privacy. If it were true, get on a microphone and say it, right? Let everybody know. See, the narc has to do this in secrecy because the content is about the narc, not about the person. So when you see projections, people starting rumors or participating in rumors, this is a very serious thing. You should run from these people. You shouldn't say anything about it. Just be quiet. Splitting, viewing people or situations in extremes, all or nothing terms, rather than integrated positive and negative qualities. Splitting, people start rumors, start splitting people and don't want people communicating together. Here, regression, that is when they return to an earlier, more childlike stage of development in response to stress. What do children do when they become under stress? Yeah. Talking, always talking, right? What do they do when they become under stress? And what do adults do? Sit down, shut up. And the children talking constantly. Acting out. Expressing unconscious feelings by behaving impulsively rather than acting on them. Dissociation, detaching from reality by separate thoughts, consciousness, and or identities. So borderline, so these are the primitive defense mechanisms that young people, that we're all born into. But as we continue to mature, we stop doing those things. And we have to consciously stop doing those things. Why? Because we don't want the suffering they produce, right? Using these primitive defense mechanisms come to a cost. Chaos, disruption. Everybody's fighting around each other. That's how you identify this, the primitives, right? So borderline personality disorders are people who've experienced this stunting in their emotional and psychological development. And the people who tend to be stuck on the ride, who can't unbuckle the seat on the roller coasters, are the ones who are locked into the primitive defense mechanisms. Meaning that the primitive defense mechanism is the basic psychological toolbox to exist as a human. But just because you have it doesn't make you human, right? Hold on a second. But it doesn't make you human. These people lack empathy, right? Which is a very important human quality. So you see a human-like figure walking around expressing primitive defense mechanisms with no empathy. That means there's no way they can get off that ride. Meaning they're going to bring everybody else on the ride, right? They're on it by themselves. And so they have to do whatever they need to do to get you and everybody else on the ride, right? That tension back and forth between allure you on, this is not going to scare you. Come on in. Like, this is not going to rattle your brain. Come on in. Like, this is not going to harm you. Come on in. Like, I need company. I need companionship. I'm on this ride all alone. That's why they spend so much time and effort trying to groom you and to listen to them. They don't want you to listen to anybody else, right? They're stuck on this ride and they want you to get on it too, right? So borderline personality disorder is a mental health condition characterized by intense emotional instability, right? Impulsive behavior, right? Impulsivity, right? Remember, good or bad. There's a huge gap between good or bad. Let's say you're doing one thing at one moment, then the person changed their mind and now they want to do something else, right? Are we in love or not? Are we friends or not? What? We're enemies, right? Okay, difficulty regulating relationships. Well, good. Good or bad, good or bad, good or bad, right? Okay. Symptoms: intense and rapidly shifting emotions, right? Difficulty controlling anger and impulsivity, right? Chronic fear of emptiness and boredom, right? Fear of abandonment, right? Black and white thinking, self-harm, distorted self-image, right? These are all sort of, if you look at a 6-year-old child, this is all they're doing, right? And because they're 6, we tolerate that, right? But what happens at 36, 30 years later, and still doing the same cluster behavior as a child? The only difference, they're bigger, so we don't look at the behavior as being the exact same thing as impulsive children. But if you look at it, it is. Look, rapid, intense shifting emotion, because your reality is different based if you're splitting. If things are all bad, then that's one world. If things are all good, that's a different reality. These are two different realities. And when your reality shift, when you're in the presence of another person who maintain their same reality, that's a lot, right? But this is the ego. Difficulty controlling and impulsivity, right? Remember that? This is that mesocortical pathway, right? Feelings of chronic emptiness and boredom, that mesolimbic pathway, the reward pathway, hypoactive. Fear of abandonment, intense need for relationship, that's that diminished serotonin, increased anxiety, separation anxiety, and things like that. Black and white thinking, idealizing the value, primitive defense mechanism, self-injury, self-coping mechanisms, distorted self-image, and identity issues. Remember, this is the target. The people who damaged this person, this was the target here. This was the target here, and you damage this, then all of this is simply a result of that. That's why they focus so much to try to damage your internalized sense of self. Okay, causes. The exact cause is unknown, but is believed to be a complex interaction between genetic, environmental, and developmental factors. Look, genetic factors. There are certain gene combinations that promote instability in the mesocortical, mesolimbic, these pathways. And if you don't have stability of those pathways, when they fluctuate, you're going to go on the rides, right? So look here, risk factors. Look, childhood trauma and abuse, particularly sexual abuse, right? History of mental illness. I'm doing a series on narcissism as a network, and I'm doing a series for the South Side Chicago called Narcissistic Black Family Cults. So if you're looking at some of the families that are engaged in a lot of the violence and a lot of the things, the gossip forming organizations, stalking you, all this stuff is nuts. When I began to look at this, I began to look at the concept of narcissistic Black family cults. When the whole family is headed by a narcissist, they simply create more narcissists. Diagnosis: BPT is typically diagnosed in adolescence, early childhood, right? Okay. It involves a combination of therapies. DBT, okay, focus on developing skills for managing emotion, improving relationships, and reducing self-harm. Managing emotions, right? Improving relationships, reducing self-harm. That's DBT, right? CBT, helps individuals identify changes in maladaptive patterns and behaviors. So this DBT this is sort of functional. It helps you sort of maintain your relationships and things like that. But cognitive behavior therapy is sort of like trying to reprogram your ego. So some of the things you believe that the sociopaths around you instilled in you for their benefits, you don't need to believe that anymore. And you certainly don't need to follow your ego when your ego sends you in that direction. Right? Then you have to understand, at some point, you're going to need to understand the difference. Okay, medications. Remember, the mood stabilizers sort of raises the action potential, and it decreases the traffic along these networks, and overall has more of an inhibitory, diminishing effect on the brain. So mood stabilizers such as Depakote is an excellent choice. Other medications like lithium. Lithium is associated with decreased suicidality. So I always try to start lithium in patients with borderline personality disorder. It also helps with cognitive functioning and things like that. Let me see. Okay, let me go explain the medication treatment of borderline personality disorder. You know, if you're a student that's new here, let me show you. Look at some of the videos I created. It'll help you. Let me see. I'm gonna show you some videos that can help you. Hopefully you can. Okay, let me see here. Okay, I'm looking for. Look at this video on the mesocortical pathway. The video on the medical, okay, here, okay, great. Here's the mesolimbic, okay, great. Here's the mesocortical, yep, mesocortical pathway. Take a look at this video here for schizophrenia, autism, and the mesocortical pathway. Take a look at that. Also, take a look at this mesolimbic pathway, the mesolimbic pathway here. Now, if you understood those two pathways, then all of this stuff, all of the medications would make sense, right? Because when you understand the receptors on those pathways, and you understand when those pathways malfunction, what symptoms they present with, then you can see that they're coming up here. So instead of chasing all these irrelevant symptoms that can appear in different combinations and different diagnoses, you can sort of funnel down to the root causes of these, and that is the network is either hyperactive or it's hypoactive. If it's hyperactive, it produces these types of clusters in all of them. It doesn't matter what receptor in all of them, what network in all of them. And when it's hypoactive, it produces similar deficits. So the medication for borderline personality disorder focuses on the treatment specific, like depression, anxiety, mood swings, and impulsivity. So yeah, rather than the disorder itself. Yep, makes sense. You're treating the symptoms. But for me, I'm trying to stabilize those networks. Commonly prescribed categories include mood stabilizers, like discussed, right? Antidepressants, SSRIs, and antipsychotics. Each targeting different aspects of the condition, such as aggression, distortion, and emotional instability. So that's one of the reasons why I wanted you to go back and look at those pathways, because it'll make sense why you want to prescribe certain medications. Okay, so symptoms, the medications are used to manage the symptoms, such as mood swings, depression, anxiety, aggression, impulsivity, and psychotic-like symptoms. It's not a cure. Mood stabilizer, yep. Lamictal, lamotrigine, and Depakote. Yeah, I would go with Depakote first, and then I would also include lithium in here. I'll include lithium in here. Antidepressants, SSRIs. Okay. Now, you may have to use a tricyclic antidepressant if the SSRI don't work. Uh, Remember, the antipsychotics is going to work on this mesocortical mesolimbic pathway. So remember, it's distorted thinking, anger, paranoia, particularly during acute episodes. Yep. Anti-anxiety still, anxiety still. I wouldn't go with I would stay away from benzodiazepines in this population because this long-term anxiety use. I'm concerned about the risk of dependency on there. So I typically never start benzodiazepines in patients with personality disorders or things like that, because I think that they're going to have to find a better way other than a pill to sort of manage the situations that lead to the chronic torment. And I think the benzodiazepines are used to escape torment. I think they're very valuable for these patients, but if some of them are so effective that they can become a crutch. Um, okay, important considerations. Okay, and so those are the those are the things right there. Okay, so now let me see if I can take a few questions. Is there anything else I wanted to do on borderline personality? Actually, let me do a peer review. Uh, Let me just um, um, yeah, let me see what they recommend as treatment. I want more the I want to look for the mechanism injury, and in the the disturbances are primarily caused by dysregulation at the level of the frontal lobe, and the frontal lobe is the seat of executive functioning. Um, there, the When patients with borderline personality disorders experience a great deal of torment, they can experience what's called a frontal release, meaning the stress becomes so much for them that the arteries that supply the blood to um, the forebrain, the frontal lobe, it can dilate, right? And so when this artery dilates, the blood pools from the frontal lobe, and you have basically an oxygen deficit. So you get the huge acute loss of frontal lobe inhibition over all of these processes. And it's the frontal release that's thought to create the disinhibition. Then you get the rage, you get the anger, you get the irritableness, and you get the self-injury. So there's a kindling process that they can experience before their triggering process takes place. And so that process to me has always sort of described more like the kindling process that may take place in seizures and things like that. So I always try to help the patients understand that experience, and then try to magnify the experience and walk through it step by step. And it helps them understand that, hey, if we can prevent the kindling, we can prevent the explosion. And so the point is, you have to make sure the blood is getting supplied to all the areas of your brain. When you get into that conflict, it can get so intense, you squeeze the blood out of your brain. When you squeeze the blood out of your brain, it becomes hypoxic. When it's hypoxic, it fails. When it fails, you pop off. They get it. They get it. Um, so let me say here, explain the Okay, explain the pathology and failure in borderline personality disorder. I want to get to the blood supply and see what they have there. Ooh, hold on one second. Oop, hope y'all didn't hear that. Okay, let me see here. Okay. I wanted to get into the pathology, like the neural psychiatry. Okay, vulnerabilities. Okay, individuals with BPT are born with a heightened emotional sensitivity that affects their neurobiological system. I don't think anything's born with heightened emotional sensitivity. You're tortured at a young. These people are damaged. These people are injured, tortured as young children. There's not a heightened sensitivity. Emotional, okay, intense emotional response. Okay, yeah, slow to return emotional behavior. Right, this described victim shaming. This described how the victim wasn't impervious to the emotional psychological abuse. Okay, invalidating environment. Yeah. Okay, well, okay, okay, yeah. Here's the vulnerabilities. Yeah, here's the vulnerabilities. Yeah. Okay, invalidating environment. Right. The individual with his biological sensitivity is then raised in a chronically invalidating environment. See, this is very important. Remember, I was describing how the ego has two components. One is an internal component, and the second one is an external component, like this, right? The external component forms first, and you integrate all of these different elements to form your internal component. And these narcissists, psychopaths, and sociopaths always understand this in detail. That's why they always have to start rumors, right? So they're trying to target someone, and they're trying to do it in a very cruel and unusual way. These people are psychopaths, right? Because what they're doing, they understand that it takes a while for the internal sense to grow. So the person is dependent upon the external ego. So what narcissists, psychopaths, and sociopaths do, they go behind your back to each one of these and basically say you're crazy or start forming rumors about you. And if this person can get other people to reflect they're trying to create a chronically invalidating environment where the people who come around you always give you the responses that you don't expect, that you don't understand, and it's not consistent with how you're engaging with the world. You're out there, you have empathy, you're engaged with the world with empathy, and you expect the people to engage with you honestly backwards. But remember, the narcissist went behind each one of these people directly, either intimidating them directly or targeting them they don't engage with you honestly. So they go through the process of destroying your external ego, right? Basically, that's like them having the capacity to remove your garage door without you knowing it. So you at home, and every time you look at the garage door, it seems like it's a door there, because you wouldn't think no one would actually remove your door and put a fake 3D mirage there like a real door. But they went through all that stuff to do that, right? So with patients with borderline personality disorder, usually these narcissists, psychopaths, and sociopaths are constantly around them, grooming people to target them. And these narcissists do this compulsively. I mean, this goes on for years or decades, and you watch them still doing the same thing because they're unconscious, right? So this is the crime, and then you see these people doing these things everywhere. So this is very important too. Listen, when you cannot get ahead, when things seems to be more complicated, when you feel like you're not being understood, this is these people working behind you, behind the scenes on your external ego, right? Now, it exacerbates the biological vulnerability. Here's the strategy. Let's see here. Right. Okay. Remember, we're all born at the bottom and then we grow. If people can manipulate the people around you, that forms your external ego, then they can increase significant emotional and psychological distress upon you in the presence of everyone, and no one will have an idea of the severe emotional, psychological torment or torture that the person is putting you in amongst everybody. And of course, the psychopath has to be there watching, right? There's another quality to this, that the psychopath is always there watching. If they're there not watching, they have like someone in their groom. they're watching. But they're trying to damage you emotionally so you get trapped in the primitive defense mechanisms. And when you get trapped in the primitive defense mechanism, this is all you can do, right? That means they've trapped you on the ride with them. They lured you on there. They buckled your seatbelt in, and they're behind you, keeping you secure to the seat so you can't get off. And while you're on that road, this is the only thing that you can do. When you partner or listen to a narcissist, psychopath, or sociopath, you are one, right? And you are on their level. Why? That's why they came to you, right? That's why they came to you. They want to know if you can do these things, the primitives, right? And they come to you in secrecy and silence, right? The narc don't want anybody to know what he or she's saying. All that's private, right? So I hope that's a very useful explanation on borderline personality disorder. These invalidating. Oh, okay. Here, I didn't finish this. Invalidating environment. Look, responds inconsistently or inappropriately to the child's private emotions or experience. If you ever seen or experienced this is just awful. Have you ever been around one of these narcs, psychopaths, or sociopaths when you've done something and then they give you the exact opposite response? So, for example, if you accomplish something, they will never acknowledge it. They'll change the subject as soon as they can. Or if you insist, they'll put you down. That's not significant, right? That's this, or inappropriately. You have to learn to recognize this, because when you're around these narcs and you're in a group, they'll say things that invalidate what you have to say. They'll say things to invalidate what you have to say. Okay. Okay, I think I'm ready now. Set a little wet, but keep going. Okay, is this the one? Okay. Okay. Okay, I think I'm locked into this page. Okay, let me see if I can get here. Oop. Guys, I think the presentation is over. Okay, let me clean this off first. My mouse is wet. Okay. Okay, let me restart my mouse. Okay, I restarted my mouse. Okay. All right, now I'm back in business. Okay, so here, okay, yeah, respond inconsistently or inappropriately. You ever had the friend that smiles in your face and talk about you behind your back, right? Or never react or support any of the things that you do positive? Yeah, this is it. Fail to teach the child how to know or label or regulate their emotional arousal. Yeah, this is significant, because these type of parents, they allow their children to sort of exist in so much stress and discomfort and provide them no relief. This is awful. I recall listening to some of Michael Jackson's videos when he described his life as a child, and it's incredibly alienating and isolating, and they ensure these people ensure that you're isolated and no one can come to your help. Okay, reinforce extreme emotional displays while ignoring or punishing the more sable expression. Yeah, reinforce extreme emotions, right? While ignoring or punishing more subtle expressions. See, remember when I told you that the ego is first two pieces. The external form is the parents and the primary group, and then your community and things like that. And then you internalize many of those values. So what narcissists, psychopaths, and sociopaths do, particularly to their children, and it could likely result in a borderline personality disorder. They do these emotional and psychological abusive tactics. So, for example, they love you when you're doing bad things, and they don't like you when you're doing good things, right? And so they sort of steer the child towards the behaviors that put them at the most risk and will likely create the most damage. They set these narcissists, psychopaths, and sociopaths, they set their own children up for failure because the children can only internalize the most sick and psychopathic things, right? So if you are only internalizing all these things when they're in a relationship with you, right? They really cannot provide, they really only can do the same thing. However, they hide it from you. They can only behave like this, but then they put a veneer on. They put a mask on, and this mask is flashy, talky, always got to be in control of the scenario, always got to be the main character, cannot shut up, cannot sit down, cannot be in the back of the room observing. These idiots always have to be the drum major. They always have to control reality, right? And so when you see these people, they present as characters, trying to be likable, trying to be the most liked, trying to be the most funny. You see what I'm saying? Trying to be the coolest or something like that. You know, if anyone else challenged for those titles, then they go for the throat. They go for the jugular. This vicious cycle prevents the child from learning healthy emotional coping mechanisms. No coping mechanisms. And reinforce patterns of emotional dysregulation, meaning they'll likely do the disruptive behavior. They'll likely do the behaviors that would get them in trouble because they were groomed to believe that that is the strategy that will help them, right? So, okay. So narcissists, psychopaths, and sociopaths damage their children by having them internalize the rules that set them up for failure. So, for example, they will reinforce extreme emotional displays, such as reward you for your violence, but then prevent you from going to school. Right? Right? Okay. Now, they are hoping that you internalize the dysfunctional behavior because you then become programmed. They become programmed as your handler. And when you internalize their value, now they don't have to watch you anymore. All they have to do is make a phone call or a text, and there can be long times of communication between the victim and the narcissist. In this case, a person with borderline personality disorder, the narcissist, they don't have to be much communication, but all the time. But that relationship is there, sort of like superposition, right? But not when one is up, the other one, no matter where it's at, the other one is down, right? So I think like this: when this is up, when the narc is up, then the clown is up. The clown is up, right? But think about that. This person had them internalize the wrong skills that will perpetually damage them, harm them, destroy their life, and basically have them perpetually seeking reunification with the narcissist, psychopath, or sociopath who damaged them in the first place. It's awful. It's sadistic. It's awful. They understand this. They intentionally have internalized things. That's why narcissists always have to lie to you all the time. When they're lying to you, they're actually putting false, wrong information into the networks. I did a podcast on why the narcissists have to lie all the time. And basically, they're trying to reprogram your super ego. And once you see that in real time, it's amazing. When they come in front of you and intentionally tell you a lie, but you can't let them know that you're conscious, that you know what they're doing. You simply watch them, be like, wow, man, he's trying to brainwash me. And just go ahead and let them do it, right? And just follow them to see how long they'll do it. But it's amazing to see them sitting in front of you, putting on this act, and you know it's artificial. And they always had that cheesy smile, that cheesy grin. You always see them with that cheesy grin. Um, so, yep, let me see. Okay. Relationship failures, right? Look, idealization and devaluing. Remember idealization, the honeymoon, devaluing, the breakup, the discard, right? Fear of abandonment. This is the number one issue with borderline personality disorder, fear of abandonment, because it's the same. It's the same. Very early, they were stunned. They were damaged at such a very early developmental age. Childhood is the fear of abandonment is the ultimate fear of childhood because they're totally reliant upon their caregivers, and this is where it goes. Very early on, they damage and traumatize people, and the patient with borderline, look, it an intense and chronic fear of being left or rejected, right? Left or rejected. Now, this is why the narcissist mainly always tries to alienate you from everyone. They want to try to precipitate this trauma that's likely there for the majority of people. They want to be included in the group. And so this is the first thing that the narcissists, psychopaths, and sociopaths are doing. When there is no evidence, drives fanatic efforts to avoid real or imagined abandonment. Now, this isn't, if you're in a relationship with a borderline personality disorder, this isn't necessarily a fear of abandonment with you. They can discard you. It's abandonment with the super narc who damaged them. So they cannot be disconnected from the super narc because super narc is the one that cloned all of their values. They made a copy of it and they put it inside the child's ego. And now the child is behaving according to the rules that they gave them and to the perceptions that they gave them. And the child, in order to heal, the child would have to break away from all of those trainings and all this stuff and say, none of this stuff is real. That was just my sick mother, right? Or my sick father. Communication difficulties. This tactic that the narcissists use to target people's egos is so covert. Who would have thought of it? I mean, who would have understood that these sick people understand the ego better than you? You're taking this in a lecture, and these people get this by talking to each other. It's like a university for psychopaths that's running for free, where the courses they teach, they disseminate, and all this stuff for free. How could narcissists, psychopaths, and sociopaths teach all of these young people while they're growing up all of these sick things for free? And our educational system is having difficulty teaching them basic stuff like reading, writing, and all that stuff. And this is complicated, right? Instability and identity confusion. Yeah, look, there's the instability here because the roller coaster, right? Look, identity confusion, right? They don't know who they are. So for example, I'm a man, so there are certain things men don't do. so I'm a man, I'm just not going to do it, right? Identity confusion is if you lose that identity and then you start doing the things that you know that you don't do, right? Unstable self-interest. People with BPD have poor or unstable self-interest or self, leading to constant shifting goals, values, and career plans. Remember, their self-esteem is dependent on who they are is dependent upon the people around them. So if you had a parent who, if a person had a parent who damaged them where they internalized the values that I'm nothing, then when they go to college and start engaging with the people, no matter how kind or how welcoming the people are, they're still going to feel that, listen, I don't deserve this. I'm not good enough for this. Y'all are too. Y'all are better than me. Right? Chronic feelings of emptiness and sense that they don't know who they are. Right? Impulsive, self-destructive. Remember the ego, impulsivity, that their frontal lobe failure. Impulsivity is the hallmark, often manifested as potentially self-damaging act like reckless spending, binge eating, untreated sex, sexual abuse, damaging, dangerous driving, right? Recurrent self-harm and suicidality. Yeah, it's very difficult on these patients. Up to 75% of our individuals with BPD have a history of self-harm, and the suicide rate is significantly higher than the general population. Emotional and cognitive, emotional lability. Look, stress-related paranoia or dissociation. Remember I said this can get so bad that it starts to impact the mesocortical pathway. And when it starts to impact the mesocortical pathway, you start having all these symptoms of psychosis. And look at this, inappropriate intense anger, that temporal lobe and that amygdala, right? This is why I think that I always go with Depakote in these patients to be helpful with that. Look, trajectory of failure without treatment. How do you repair something that's working correctly? It's just that you would have never thought that there was a program at the beginning of the story, intentionally programming the person incorrectly, program them to constantly feel depression or sad or negative emotions if you're not with them or if you don't agree with them. That's a deeper level of sociopathy. So I think that's it for my discussion on borderline personality disorder. Let me see if I can just take a few questions and stuff like that. Hey, thanks. Hey, freaking Flax. How's it going, buddy? What strategies can family use to better support a loved one with PD? Boundaries and stay out the movie. I suggest you don't get on the roller coaster to try to help. I suggest you stay off the roller coaster and just watch. Send messages. I suggest you don't do that because it's going to end up the same way it did the last 20 times, right? You're going to bust your head again, but I wouldn't rush in and try and save them. Rushing and trying to save them. You rush in and try to save them, they're going to lock you in on the seat. Hey, Maquina, how's it going, buddy? Very good point. Understanding the diagnosis may improve empathy for patients and their families. Yep, sounds good. I think that's all I have for today. It's been a pleasure to speak to everyone again. And I still want to send a shout out to all the sitters that I work with. I'm going to see about at least having chicken wings on Friday or something like that. But I do feel the need to reach out and see if I can support you guys as much as I can because you've given me so much support over these years. And I don't think I've had a chance to really step back and thank you for that. If it wasn't for you sitters, I don't think I'll be able to do the job that we're doing. So I really want to thank you in advance. And I hope you understand my lecture on the borderline personality disorder too. Hey, this is Reed here. I'm out here. My next podcast is going to be on Charlie Kirk and what it means for the South Side. I think it's going to be a significant issue. So stay tuned to that if you're interested. Take care, guys. Reed out. I'll talk to you later. Take care, guys. Reed Matrix. Ciao.